Where did you first see me? On
YouTube. I've been watching you since 2020. Watching like, oh my gosh, I want her to work on me, but I don't know how this works.
Tell me what's going on, like what you...
So I have a lot of migraine issues. That's a big...
Is that the big one?
That's the big one. And so I get Botox. Actually, I didn't put that on my medical form, but they do in my suboccipital. She does into the scalp, and then she does the upper trap every 12 weeks.
Really? But anything else besides the headaches that you want me to address?
I do have hips. Normally, I like roll on a tennis ball right on like my lateral hip flexor a lot. It's like pain in the lumbar, L4, L5.
Okay.
And so like releasing this seems to help.
And then possibly you said, oh, what was going on with you said there's a hiatal hernia that you can see?
Yeah. I know I have a hiatal hernia, and I'm just guessing that's what that is.
It might be from when you had kids, like a little bit is popping through.
Oh, okay.
But the stomach is over here. Okay, the stomach is up in here. And when you have a hernia, it's popping up in here above that.
Well, then maybe that's
so this is a little too low to be that. Do you notice that like when you have, does that poof out more when you have pain, I guess?
No, but I do, like I teach yoga and stuff, and when I'm doing core stuff, I can kind of feel like it's, like I feel like it's going to pop out or something.
Well, yeah, because when you have children, that separates, and then you are prone, that fascia gets thinner, so then every time you it is prone to kind of poof out there. Yeah. So sometimes they can do surgical repairs for it, but if it's not bothering you and it's not painful too much, then it's up to you. There's a little bit of a rotation in your pelvis. That corrects it.
Like that.
Yeah, like you're just dropped on that right side, left high shoulder, and then so you kind of, your body does one of these. Yep. Go ahead and just walk to the edge of the carpet for me. Have it come on back. Just kind of take a couple steps, let your arms swing. I'm just kind of trying to see how your body is in space. There it goes. I saw it on the turn.
Yeah.
I'm like, oh, she's stuck. Okay. All right. So where I would like to focus is more on the pelvis. Your pelvis is stuck.
Yeah.
Right in here around your SI joints. Okay. It's just not dropping and moving. I mean, it's been a while since your last adjustment, but even though you do the yoga, that's more, well, it helps the joints too. Helps you. But sometimes the impulse is just enough to kind of get it going again. This is levator scapula, scalenes. Nerves exit here. That's what I'm after.
Okay.
So I don't really care if you fight me because it's the connective tissue. Now here's where it's different. I come up in here. There's your joint.
Okay.
This is what I'm relaxing prior.
Right.
Chin back for me. Ooh. Good. You all right?
Yeah.
It was nice. It's a good one.
Yeah.
We'll do the other side. She's still with us. Yeah. She's still like, she's like checking her vision. Do I still see? Yep. Very nice. There you go. Easy. Now, that did take some of the neck tension away, I feel.
Yeah.
This all relaxed. Let me check the suboccipitals. Chin back for me. Still tight here.
Mm-hmm.
We'll get it in a second. I gotta do some more work on you. I'm checking where you place your weight, okay?
You know, I have like the fourth toe on both feet are missing, like one
of the joints. Okay,
so, you know,
cool.
Yeah.
Definitely placing it on the right though.
Okay.
Yeah, this side. Ankle. This is stuck.
Yeah.
Yes, because so you see how this one moved?
Yeah.
This one, I can't get it to move.
That's the side of my hip.
This is going to move before this.
Oh, really?
So what we do is, I check it first. I'm not going to pull hard on this one. It already moved.
Okay.
This one's stuck. Right there. Then I can give a little more. Grab onto it a little more. That's all she gets. It went a little bit the first time.
Okay.
That's all it had.
Right.
Good. I'm checking all your lower joints. You don't have to have this done every time, but it's amazing what we find. Now, you want that hip released?
Yeah, sure.
Yeah. What we can do, since this is so stuck, I don't have to worry about it, whereas I couldn't really do it on this foot because this will go before the hip.
Okay.
I'm going to slide you down, okay?
Okay.
There it goes.
Oh, yeah. That was interesting.
Stuck in the red. You gotta be fast. Come on and sit up and see how the neck feels. Just kind of take it. Yeah. I'm not done with it by a long shot, but make sure that nothing's like stabbing or anything. You're okay. All right. Anything sharp?
Mm-mm.
So take a deep breath in. Oh. Sorry, I had to push a little harder there than I wanted to. You okay?
Yeah.
Deep breath in. Oh. Good. Very good. You're doing great. Deep breath in. Oh, there it goes. And again. It's going to get tighter as we get to the diaphragm. That's totally normal, okay? I usually have to loosen that up on most people. I can see your QL muscles are really developed back here, and you're starting to lose a little bit of the lumbar curve, okay? We got to get that back.
Oh, no.
Well, that's why we're getting pain back there, okay? This is so overly contracted, it's lifting you this way.
So, like, I've been trying to, I felt like I had an anterior pelvic tilt. I'm
I
trying
don't-
to reverse it, but
No,
maybe
yeah,
I was over,
no,
okay?
no. What you just did there was
Yeah.
making it worse.
Okay.
And then you did something and you made it better. You did, that's what you need to do.
Okay.
I don't care if you have an anterior pelvic tilt. Great, leave it alone.
What?
Do you understand? Why would you get a herniation if all the weight is off the discs?
Right, right.
Now you're going in there and you're pushing this back and you're putting weight, and now you're going to get pain down the legs.
Okay.
This isn't curved and contributing. They're designed to work together as a set. There's 5 of them down here, right? L1 through L5. If L4 and L5 are the only ones in the anterior pelvic tilt, sure, you're going to have pain right here. And these guys are like, I don't feel anything. These guys need to contribute. So you're going to feel me kind of work a curve back in there.
Okay.
Okay.
Yeah.
All right, so we're going to start with skins pulling.
Okay.
Oh, I don't think we have anything. Feels good. No, feels great. 1. Very good, though. Okay? Now we need to get that back. What type of yoga do you do?
I like to do power,
Okay.
but I'm teaching like a slower flow.
Okay. Just be careful with the forward bends.
Oh, yeah? It's bad on the back?
It's hard on the low back,
Okay.
especially if your fulcrum is here.
Uh-huh.
Like forward standing head to knee, stuff like that.
Mhm.
Just be careful with those. Keep the curve in here.
Okay.
I know, complete opposite of what you've been doing.
Yes.
Camel's great.
Camel, yeah, no back. Bow pulling pose, half locust, cobra, have at it. The ones where you're going forward, you have to keep this
Be careful.
straight. You can't have curve in your lower back or you're gonna regret it.
So I've learned that, like, I recently got my personal training certification, and they were saying don't foam roll the lumbar.
That's true.
Is that why is it? Why should we not?
I wonder if they got that from me. I'm the only one that's ever said that. It's okay. If I want to create a curve and I put the fulcrum, bam, right there, that's a lot of force on the facets. I'd rather go above it and below it and create a curve that way. the lumbar spine is a compromised area. So if you go and you put a lot of force into it, you risk injuring an already injured area. You put it in the thoracic spine and the pelvic spine, and you create the curve that way.
Okay.
You put pressure and compression, and these will naturally arc. There you go. Okay, now let's go into that quote-unquote hip region. Sorry. Gotta get up at an angle here. This is your good hip, right?
Yeah, this
So-
is a good one.
This is a good one. But I still have to work on this SI joint right here.
I would also just add the low back is not made for movement to begin with. It's made for weight bearing.
Yeah, there you can get into all kinds of. That's advanced. That's advanced. Paper towel method is where we're at right now. There you go. No, it's okay. Now I get it.
It's also a more precise way
Of identifying it.
identifying what's wrong there.
Trying. SI joint. It's a little balled up
Really?
here. Okay. So take a deep breath in again and bounce. Here we go. And again. All right. So this is what I want to bring down. Here we go. Excellent. I'm going to do the subscapular, rhomboids. Subscaps are over here. One more. There we go. Done. Other way. Go up this way. One of them always gets you. There's always one. She was unfazed by this. But she was phased by this one.
That one, yeah.
Yeah. That's not a dragon. Excellent. I don't feel anything there. Well, not in that position. I mean,
Okay.
I gotta go underneath. There's another layer.
Oh, I can feel those.
Well, they're always kind of sore. Infraspinatus, because the brachial plexus is there.
Mhm.
Sure, you know that. There you go. Drink a lot of water.
All right.
Should be floating after this. Oh. No, you are bruising.
Oh, yay.
I know. We're all excited when we actually do bruise.
Right.
It's like, yes, get it out.
I get cupping from my acupuncturist and it never marks. So,
Really?
yeah.
Okay, so there's testimony then. This, I keep saying it's a different level. It's a different layer,
Yeah.
the cupping.
Yeah.
So I never do them at the same time because I'll actually pull the blood through the skin, and I don't think it's necessary.
Right.
I don't really. I just say it's not necessary because I don't like blood. You don't really need to go that far.
Nobody wants blood out.
No.
No.
I wear gloves. Can you see how the hypochondriac I am? Yeah, no, they're different layers of fascia. They do different things. One's pulling, one's pushing.
Right.
So you just needed the push. You've had enough of the pull. Yeah. There you go. More bruising on this side for sure.
Okay.
And this side bruised more than this side. Actually, this side barely bruised at all. Which is kind of surprising, but...
Does it mean that the blood's not coming to the surface, or what does it mean when it doesn't mark?
No, there's more inflammation over here.
Okay.
Because when we do skin grafts and we test this, it's combined with inflammatory markers.
Mm-hmm.
So the areas that don't have it don't have inflammation. Whereas the areas that we do pull it out have the inflammation.
Oh, okay.
So our best guess is that it was inflamed to begin with. Not that we created the inflammation.
Right.
Because why do we scrape this, right? And absolutely nothing comes out. Whereas we do this, and it does. There's inflammation here, not over here. Can't you tell, Dr. Mondragon? I try. I usually give a pretty good guess. There's always sometimes little surprises. Like that. You're just asking a lot of yourself.
Yeah.
Yeah,
I am.
your little muscles here.
Yeah.
How often do you teach?
I have like 2 regular classes a week. That's it.
Okay, that's
Yeah.
not that bad.
How close together are the 2 classes?
2 different days of the week. I have like one. They're all on Zoom though, so I have to do it. You know, I like when I teach in person, I'm walking around talking, not doing the practice, but on Zoom I end up doing it.
Yeah, that's the only way to show.
Yeah.
Okay, so now I'm gonna take this and kind of go through the neck, tuck your chin to your chest. See how I'm supporting her this way. I don't want to have her hanging. It's just like, I guess that was right. I just didn't. There you go. Okay. Now we're going to open the hair. You do have a prominent EOP.
I do, yeah.
So I'm like, okay, it's not that. You know, I'm like, hold on. It's underneath it. How is this, though? It might be too aggressive. I'm having to push pretty hard. It's kind of like the comb. It's deeper than what the comb treats. So I'm going to kind of go up into here, okay? Here we go. Pull. Really tight in here. Usually the skin is pretty loose and it's pretty adhered. It's really tight. Doing okay?
Yeah. Great.
I'm pulling hard. There it goes. There we go. Yeah, finally.
Yeah.
It was just glued. Good. Now let's go back to this. Yeah, there we go. I'm so sorry. Okay, that feels better now. Okay, so I'm just gonna work really small right here, okay? Kind of drag this one up. I'm gonna go real deep. There it is. Any headache? Are you doing okay?
Oh, I'm good.
I just want to be very careful here. All those nerves are right here.
Yeah.
holding on. First go. She's like, okay. You should see my positioning here. I'm really yanking on you. I don't think I've ever had to do this. All right, take your time and come on up.
Oh my gosh. Wow. I am so impressed.
That little bit here,
Yeah.
sorry.
And nothing
And the
on
low back
this side. Huh.
I mean, like,
That's interesting. And so it means this side's healthier?
you are like turned. Remember your left high shoulder?
Yeah,
And I told you at the
yeah.
very beginning to do what? Go this way.
Yeah, and here I'm like, what
Yeah,
are we
it's
looking
because
at?
you're a little swollen. Okay, it fills up with fluid as you lean to the side.
Okay.
Does that make sense?
Yeah, yeah.
Where the curves are and the bends, it tends to be edema. So you have more edema on the left hand side of your neck because you tend to. You're kind of just all like this.
Yeah. And stop at the. I don't need to.
I wish I could. Can I like take a video of it to show you?
Yeah,
Because
yeah.
maybe it would make more sense if
Yeah.
you saw it.
Yeah.
Now go ahead and do a posterior pelvic tilt. And now lift your chest. Yeah, do that. Now do a posterior tilt. There you go. Now they flare out.
Wow, yeah.
So when you do this, the muscles now. Go ahead, put your hand behind your back. Feel it. Put your hand on your back. Now do a posterior pelvic tilt.
Yeah, yeah, I like it.
Now do an anterior.
Yeah.
See how they relax?
Yeah.
So what I'm going to do is kind of reinforce that.
Okay.
So you're going to be on your side facing me. Nope. Well, there goes one. I'm going to kind of see how I'm reestablishing this curve here. I'm pushing here and here. You understand?
Yeah.
That's how it's going to go. Other side. I'm not going to force it. There's just these bars at home. Back for me. See, I'm going this way. This is the pubic symphysis. It's up to you.
Yeah. Yeah.
All right, press your thighs out against my arms as hard as you can. Good, and squeeze.
Oh wow.
There we go. And stop.
That was cool.
Yeah, there's 3 joints. 1, 2, 3.
Yeah.
So we got them all. Very good.
Yay.
So, yeah, just tuck your chin to your chest for me.
Mhm.
Like, just lift your head up off of the. It feels good.
Okay.
And then relax back down. I do feel what you mean. You still have heartburn?
Mm-hmm.
Do you have heartburn right now?
Uh-uh.
Be a good test, but.
I can feel something when you push
Oh.
down there.
So that's your stomach.
Okay.
That's the stomach.
Okay.
Yeah, if you hear it.
Yeah.
Let me find
Okay,
let me
go.
find where it is. It's a little bit.
My stomach's
Lung.
up there? Really?
Lung.
Huh.
Liver. See how it's more of a
Yeah.
thud.
Yeah.
Liver.
Okay.
Normal. Gut.
Oh, that's echoing.
Gut.
Yeah.
There's your ascending colon.
Okay.
Transverse. Trying to find. I gotta get my fingers kind of up underneath the diaphragm here.
Okay.
Well, underneath the ribs.
Mhm.
Deep breath in again. There it goes.
Oh yeah, I just felt that.
There you go. Ain't much to you. There we go. Deep breath in. I'm gonna go for the epigastric one. Yep. I know. There it goes. All right.
Wow.
I want to create like a little hollow space in here. Now this is more of a diaphragmatic release, not so much stomach here, okay? Breathe in. Just a little adhesion right here.
Oh.
There it goes. There it is. All right.
Okay.
See how that feels.
Okay.
Did I not make you nauseous? Hopefully I didn't.
It feels tender. That's normal?
I did.
Okay.
I did like
Yank
yank it.
Okay.
I did. So the butt is on the ground. That's one side of the force.
Okay.
Your rib cage is the other side. And you're making a curve here.
Okay.
Yes. There you go.
See, now that they were towel's going that way.
Yeah.
There you go. I think that's enough.
Like, that's it.
So that's where you can place your foam roller. Place it up there.
There.
So the butt and the mid back are your.
I'll never forget the paper towel.
Well, I don't know how else to see. I like some way to remember it. You know, okay, Dr. Lumbar said not in the low back. Now I know why. All right. Any other questions for me?
No.